Hello and welcome to Families USA's Health Action Conference, Health Justice Now. I'm Lisa Hunter, the Senior Director for Strategic Partnerships at Families USA, and I'm so thrilled to be welcoming everybody to today's conference, drifting into tomorrow. Thank you again for making it out to the conference. Thank you as well to our speakers for pulling together an amazing program and agenda for all of us. And thank you to the staff at Families USA for making this all possible. I am going to start things off by encouraging everybody and inviting everybody to use the chat box function in the portal right now to introduce yourselves. So if you could drop in your name, pronouns, organization, state, and if you have a yen for it, maybe your favorite type of cookie. So for me, it's Lisa Hunter, she, her pronouns, Families USA, Washington, D.C., and I'm going to say chocolate chip because I'm pretty basic, but I also want to signal to the health action team at Families to please take copious notes because I have a feeling we have an interesting cookie platter coming our way for next conference. So thanks for doing that. All right. Now that we have the chat box up and running and all of you all are firing off your answers and introducing yourselves, I'm going to start us off with some wayfinding through the portal. I know we've been there through 2 years of virtual existence, and it still doesn't help, or it still helps to make sure that we have our bearings. So first things first, look to the bottom left of your screen, and you'll see there the live text support icon. So this should give you an enormous sense of comfort because if you ever hit a snag or need to troubleshoot anything technical, there is a live person on the other end of that chat box. So feel free to use them. There's also an email address that you can use if that's more comfortable for you. And that email address is tech-help@jdc-events.com. Great. All right, so now going clockwise, go ahead and look at the top of your screen. You'll see the directory there. That is where we tried to replicate networking as best we could. And I think we got pretty darn close. So you can do one-on-one networking. The portal will give you some suggested advocates to look for. And you can sort of search around for like-minded attendees. Without leaving the portal, you can message them. You can schedule time to meet with them. You can also just have a chat with them throughout the conference, which is pretty great. All right. Next to the directory is something called the Engagement Hub, which is a lot of fun, and I think you should take advantage of this during the breaks. In the Engagement Hub, you'll see virtual partner booths, and if you've already been poking around the portal, you will have seen some of our partners who have booths starting to hype their booths and the initiatives that they're highlighting there. So please, when you have a break, it would be great for folks to meet other partners and engage and get keyed in on initiatives and successes and calls to action from our virtual partner booths. So check that out. If you're looking for something a little bit more lighthearted, we also have under the Engagement Hub, the Wellness Corner. And the Wellness Corner is really where you can indulge in yoga, meditation. We reprised Jen Taylor at Families USA, her role in Little Advocate Storytime. That was a fan favorite from last year. And we also have pet videos because everybody loves pet videos. And then if you keep going to the right side of your screen in the upper corner, you'll see a bell icon, and that's the notifications icon. That's where we're going to prompt you to navigate to places when things are starting, when things are happening. And it's also going to give you some tips on ways to optimize your experience throughout the next 2 days. So definitely keep paying attention to that. If you look to the far right of your screen, you'll also see a trophy icon. That is the leaderboard. So here's how it works. For all attendees, the more that you engage and interact in the portal, the more points you earn. At the end of conference, you'll see that the leaderboard has the top attendees ranked out there. Those 3 attendees at the top of the leaderboard at the end of conference will earn a gift certificate to the Outrage, which is an activation or an activist hub, I should say, here in Washington, D.C. And even if you don't get those, even if you don't earn the top scoring points to slot yourself a gift certificate, that's okay. All attendees are also have available to them a 15% discount at the Outrage. So we'll put the code in there and it is good through Valentine's Day. So thank you to the Outrage. The other thing that I want to call your attention to is the snap bar, which is also on the right-hand side. And you'll see it kind of looks like a selfie icon. And that's where you can take photos of yourself with cool borders, stickers, etc. And then everybody's snap bar photo will be in our gallery, which is internal to this community. And it's, if you go through it, you'll already see there's some really fun photos in there. So thanks to everybody for starting that up. And I hope you all make your way over there at some point throughout the conference. Okay, I think that concludes Lisa Hunter's guide to surviving the portal. My biggest piece of advice to you is to please have fun, engage with one another. This is all about building community. And at the end of the day, this is all really for our partners and to thank you and make sure that you are having a really amazing time engaging with one another. And just like I said, building that community. So with that, I would like to introduce our co-founder and president, Phil Villers, for some welcoming remarks. Phil, please take it away.
Good morning, everybody, and welcome to the 27th Health Action Conference. The theme of this conference is Health Justice Now. This conference has been the meeting place of the movement for health and healthcare transformation for all, and continues to be that. Many of you can probably remember a few years ago when our keynote speaker was then President Obama. And at that conference, he was generous enough to say that our movement, and therefore this group, made the AC possible. And without it, it probably would not have passed. A very generous statement on President Obama's part. And it was an enormous stride forward. And today it's the foundation we seek to build on. The next step, as all of you know, is the bill already passed in the House of Representatives, the Build Back Better, or BBB as it's known. And today we fight to take the next step forward in passing it in the Senate to expand and improve healthcare coverage. And as often the case with reform, it is a tough fight. Thank you for joining us in this, the forum of the reform movement for health and for healthcare transformation for everybody in this country. Personally, I look forward to the 28th Health Action Conference next year, which I trust will be in person, and look forward to meeting again a lot of you who've been to a number of these conferences. But today, the fight goes on. We fight to protect, expand, and improve, especially not only our right to vote, which is under attack and is fundamental to everything else, but the right of women to choose and to control their own bodies. We have much to do, and as a movement, we have a defined track history of overcoming enormous obstacles. I trust we will do so again. Enjoy the conference as we continue to learn from each other. Welcome and thank you.
Thank you so much, Phil. Absolutely. Ours has a track record of overcoming some wild odds. So thank you so much for those remarks. Next, it is my honor to introduce to you Congresswoman Lucy McBath, who represents Georgia's 6th Congressional District. So shout out to the Georgia partners who are in the House. Like many of you, her advocacy stems from a deeply personal place. In 2012, she lost her son, Jordan, to a senseless act of gun violence. And this tragedy motivated her to leave her career as a flight attendant and join Everytown for Gun Safety and Moms Demand Action for Gun Sense America. Then the tragic shooting happened in Parkland, Florida, and that's what really sparked her to run for Congress. She's now in her 2nd term, and she has earned the reputation as a leader in developing bipartisan solutions, not only to end gun violence, but also to lower the cost of healthcare and prescription drugs. She's an extraordinary advocate, woman, member of Congress, leader, and we are just so honored for her to be joining us today and sharing her inspiring remarks. So Representative McBath, the floor is yours.
Hi, this is Congresswoman Lucy McBath, and I am so pleased to send my greetings to the 2022 Families USA Health Action Conference. As you convened this week to mobilize around issues of health equity and access to care, I want to offer my profound thanks to the advocates, activists, and healthcare professionals who are truly making a difference every single day in America. I know that this is not an easy time for any American, but I want you all to know that the work that you're doing truly matters, and your dedication to the public, to helping families across the country, and to making a positive difference in your communities is an inspiration and a motivation for me and my colleagues as we continue our work here in Washington. For over 2 years now, we have watched doctors, nurses, and healthcare personnel step up and fight the COVID-19 pandemic head on through what I know has been an unimaginably difficult time for you. Your dedication and devotion to taking care of our friends, our families, and loved ones has been a true sacrifice. And as we continue to do all that we can to put an end to this pandemic in Georgia and across the country, I want to thank you for your tireless work, the work that you put in to keep our communities healthy. It's thanks to healthcare heroes like you that I am here today. Twice I received the news that I had breast cancer, and twice, thanks to the power of medicine and a top-notch team of doctors and nurses, I beat my cancer and can proudly call myself a survivor. Healthcare isn't a single moment in time, but a lifelong effort. The health of our friends, families, and loved ones is never far from our minds. And like many women in America, my story includes a struggle to get pregnant. My son, Jordan, was a miracle for me and my family. But for too many mothers, the miracle of pregnancy often ends in tragedy. The United States has the worst rate of maternal death in the developed world, and our home state of Georgia has the second worst rate of maternal death in the country. For Black women in America, the rate of maternal mortality only increases. It's why I'm so proud to be a founding member of the Black Maternal Health Caucus, and why I appreciate each and every one of you for your continued efforts to help pass the Momnibus, legislation that will help fund the critical services and research that we need to save the lives of our American mothers and their babies. Once again, I want to thank you all for the amazing work that you're doing. I hope all of you know how very proud I am of you for your dedication to the enormous task ahead of us. Because keeping our families healthy and whole is an effort that never ends. And while the last 2 years have been so difficult, your work has saved the lives of countless mothers and fathers, and your efforts have kept families from experiencing the pain of losing a loved one. I pray this conference is re-energizing for those of you who may be feeling down, because you have made a difference and you will keep making a difference. And you have helped save so many lives. Stay healthy, stay safe, have a wonderful conference, and God bless.
Hi, my name is Paul Gibbs. And I've been proud to work with Families USA for a number of years now to tell my own personal healthcare story and to advocate for positive change. I was born with a serious kidney condition, and in 2009, I was able to receive a life-saving kidney transplant from a living donor. And because of the Patient Protection and Affordable Care Act, I had and have the protections to guarantee that I can't be discriminated against because of my pre-existing condition. And because the ACA gave me that guaranteed right to healthcare coverage, I was able to get the coverage I needed and go on to be healthy, get married, and start a family. Now, for years, many of us have been telling our stories to advocate and to protect laws like the ACA. That's why we're here. There's still a lot to do. We've stood against countless political attacks on the ACA, and we've pushed for improvements and reforms that will make healthcare access more affordable and better for Americans and their families. In 2019, I had the honor of joining Families USA's executive director, Frederick Asazi, to testify to the House Oversight and Reform Committee on behalf of myself and my children and millions of other Americans who would have lost our access to healthcare if the ACA had been struck down in federal courts. Since then, I've received many calls from Families USA to share that story and to advocate for others, because Frederick and his team at Families USA are deeply committed to putting stories like mine and all of us at the center of the conversation, where it belongs, because healthcare is an issue that is first and foremost about people. As executive director of Families USA, Frederick is committed to advancing a policy agenda that will help us to achieve lower costs and better care for Americans. We'll be able to reduce the systemic inequities in the American health system. Under Frederick's leadership, Families USA advocates for critical issues affecting families in America. These are things like fair drug pricing, racial equity, maternal and child health, and oral health for all. All of these such important issues, and Families USA does so much for these things. I'm so proud to have an association with them. We have so much work to do, but together, all of us, we can advocate for positive change on these issues. We can keep going. We've made change before, and we can do it again. And I'm so proud to be associated with everyone here today. And with that, it's my considerable privilege to introduce Families USA's Executive Director, Frederick Asazi.
Thank you very much, Paul. That was a really lovely introduction, and we are so proud to be partners with you in this work. And a very good afternoon to all of you who are joining us virtually, and a good morning to those joining from the Mountain and Pacific time zones. It is an honor to join you today and a joy to continue the tradition of the Health Action Conference for another really important year, almost 3 decades of coming together to connect, learn, and organize to move our nation closer to the goal of ensuring the very best health and healthcare are equally accessible and affordable to every living soul, no conditions, no exceptions. And what a strange and unique time for us to be together. A devastating once-in-a-century pandemic has brought to center stage the interconnectedness of health and the deep inequities in our society. This gives our movement power and currency, and we are all committed to ensuring none of the suffering and the loss is forgotten, that we will move our society forward. And there's also been some really important wins. The power of national and international unity has allowed us to develop effective vaccines, share information, and protect hundreds of millions of people. We've watched as the Affordable Care Act, through Medicaid and the health insurance exchanges, protected access and provided real financial security to tens of millions of families. as job and job-related health insurance coverage was lost because of the pandemic. We rang in the new year with millions of families finally getting relief from surprise medical bills, thanks to the aptly named No Surprises Act, which we all worked so hard to get across the finish line in 2020. We've never been closer to finally addressing, through federal law, head on, the corporate greed of prescription drug companies. And we stand on the cusp of finally providing Medicaid coverage in those states that continue to refuse to extend coverage to the most fragile souls in their communities. We are fighting on every front, fiercely, united and mighty as hell. And yes, let's say it. Through the federal COVID and economic recovery packages, through the legislation we passed in state capitals, and the progress through state ballot initiatives, we are winning so many battles. But winning a battle is not the same as victory, and we need to keep fighting. As I speak to you, as you've heard from several of our speakers, President Biden and congressional leadership are turning to finish work on Build Back Better, one of the most important pieces of legislation that has been written on Capitol Hill. And yes, the legislation will continue to change, but it remains an incredible opportunity. We all need to lift our voices today, immediately, to make sure we get this bill through the Senate and to the president's desk. Then we'll look beyond Congress to the opportunities with the Biden administration on the federal level and on the state level, in state capitals and with governors to keep this success going. And of course, we are all part of the larger movement that goes beyond specific health policies and gets to the heart of other key issues that create a fair society. Issues like education, voting rights, housing, immigration, and racial justice. But at the end of the day, everything we do comes down to these people. Everyday working people, moms and dads, kids, grandparents, white, Black, and brown, who all deserve a society that allows them to live their healthiest life, period. For every policy victory, large and small, they are the real winners. A small change in a House committee report or a high-profile bill signing can mean another 5 years of life, buying groceries and prescriptions, or a happy, healthy childhood. That is what Families USA is all about. That's what all of you are about, and why we're here today and every day. So thank you for joining us, and thank you for being partners in this hard work. And let's go ahead and acknowledge the elephant in the room. I know we're all itching to see each other in person, but this pandemic, it keeps locking the doors to the Hyatt basement. Who knew how much we'd miss those elevators or escalators down to Columbia A and lunch in the Regency Ballroom? But I'm optimistic. I have a really good feeling that next year, as Phil said, we can all hug and dance and enjoy the mac and cheese happy hour, and it will be in large part due to your continued advocacy. And don't worry, I'm not going to be the millionth person with another take on where COVID is going and how we get back to normal. I'll leave that to our friends like Dr. Fauci and Dr. Lewinsky. And as I mentioned earlier, COVID has helped more people in our nation understand something that no $500 million marketing campaign ever could. COVID has made it impossible to ignore everything that's wrong with this balkanized and still badly broken healthcare system. The way people of color are first to get sick, yet last to be able to access care, and in the front lines when it comes to discrimination. That getting sick or staying healthy is determined by our zip code and the size of our savings accounts. That to big pharma, life-saving meds are about bigger profits and CEO bonuses, not lowering the cost of insulin, shrinking cancer cells, or ending heart disease. That a $3,000 doctor bill can come out of nowhere, and spoiler alert, they come from the C-suite. That a national army of public health leaders has to go to war with governors to get them to put the lives of their constituents ahead of politics. Let's be more specific. These governors, how sad their leadership has been. The thing is, health isn't a red state versus blue state issue. It's a kitchen table issue, just as Paul said. A majority of the American people want exactly what we're all fighting for, whether they wear red hats, commute to downtown jobs, live on a farm, or hang Black Lives Matter posters. All of you know this better than most. And joining us today are so many amazing leaders and organizations. The Colorado Consumer Health Initiative and the Oregon Coalition for Affordable Prescriptions, who won hard-fought battles for prescription drug affordability boards, joining Maryland as leaders in lowering the prices of prescription drugs. The Oklahoma Policy Institute ensured Medicaid expansion was implemented effectively, on time, and hundreds of thousands of Sooners enrolled. Millions of people across the country have gotten COVID-19 vaccines, plus testing and treatment because of organizations and advocates in every state pushing for equitable access and outreach. You helped close the gap so that people of color, adults with disability, immigrant families, and communities that have been traditionally ignored by our healthcare system would be protected and healthy. Bravo. I hope you all can hear the applause and feel the love. And that is why President Biden is speaking to us today. He knows what all of us at Families USA and all of us in this virtual room know, that all people in America, no matter where they live, how much they earn, what their race, gender, or ethnicity is, all people should be able to live their healthiest life. No one's health should depend on their wealth. He knows, and we've all worked so hard to make sure other politicians know, that what's good for America's health also happens to be good at the ballot box. He knows all of you, all of us, are the best fighters to protect the health of working families anywhere. I've worked with many members of Congress, governors, and White Houses, and I think we've never had a White House fighting harder for health. And truly, we are honored to have the president with us today. With no further ado, Mr. President, our Zoom is your Zoom.
When I took office, I made a promise to the American people to do everything in my power to ensure that all Americans have access to quality, affordable health care, because I believe that health care is a right, not a privilege. And thanks to your hard work, more than 4 million people have gained coverage since I became president. The open enrollment period that ended a few days ago saw record-breaking numbers of applicants. And that means more families across the country gaining peace of mind. It's about peace of mind. But we're not just expanding coverage, we're also lowering costs. Thanks to the American Rescue Plan, families who get covered through the Affordable Care Act are now saving $2,400 on their annual premiums. That's $200 every single month that can now go to grocery bills, new clothing, shoes for the kids, toys for the kids. Over the last year, we've made healthcare more equitable. For example, with your support, the Vice President and I have made it easier for new moms to keep their Medicaid coverage for a full year after delivering their babies. You know, we've made historic investments to improve maternal health care, especially for Black women who have faced unequal outcomes for much too long. We're making great strides to keep families healthy and safe from harmful pollution by delivering clean water, clean air, affordable housing, clean energy. There's so much more to do, and we need your help. We need the Senate to pass my Build Back Better Act, which would lower premiums for more than 9 million Americans, cover 4 million Americans in states that have failed to expand Medicaid, lower prescription and drug costs, and bring down the cost of the price of insulin from $1,000 a month to $35 a month. It only costs $10 to make it. You know, we have to get this done, and we have to get it done together, and we will. So I'm going to thank you all. Thank you for all that you're going to do. And I look forward to continuing to work together to deliver on the promise of equity and affordable health care for everyone. And I mean everyone.
Thank you, President Biden. We appreciate your efforts to advance health equity and justice by including historic healthcare provisions in the Build Back Better Act. You've shown a commitment to making healthcare more accessible and affordable for millions of Americans so that they can lead healthier, more productive lives. My name is Shiloh Jones, and I'm the Senior Manager of Health Equity here at Families USA. As you know, our conference theme is Health Justice Now. So I'm delighted to kick off our opening session, Stories of Struggle and Hope in the Fight for Health and Racial Justice. Leaders from the movement will offer perspectives on how we can keep the spotlight on these issues in 2022 to ensure momentum and progress. Before we get started, I'm going to cover a few housekeeping items. We encourage you to introduce yourself in the chat if you haven't already, and to use it to participate in the conversation. If you experience any technical difficulties, please use our help desk icon at the bottom left of the page to connect with a live agent for assistance, or to email tech-help@jdc-events.com. So now let's get started with the session. I'll first turn things over to our moderator, Juliet K. Choi, President and Chief Executive Officer at the Asian and Pacific Islander American Health Forum. Thank you so much, Juliet, for facilitating this conversation. Over to you.
Great, thanks so much, Shiloh. And for everyone who's joining us today, thank you so much for who you are and what you do day in, day out. I am absolutely honored and delighted to welcome our panelists today. We have Monica Simpson, Executive Director of Sister Song Women of Color Reproductive Justice Coalition, Sid Betancourt, Housing Advocacy Organizer with the National Low Income Housing Coalition, and Ola Ojoumi, Founder and Director at Project Ascend. Panelists, thank you so much for sharing your wisdom and your experiences today. We have this virtual fireside chat conversation. Again, I want to welcome each and every one of you. What I'd love to do is ask each of you to go ahead and introduce yourself in your voice and share how does racial justice show up in your role and your work. And before we conclude today's conversation, what do you want to make sure today's health advocates learn from our country's justice movements? So let me go ahead and ask Monica, why don't we start with you?
Good afternoon, everyone. It really is an honor to be here and to sit on this panel with such amazing people that I really admire and look up to. And this conversation around racial justice for me is absolutely centered and critical in the work that I do for reproductive justice every single day. Reproductive justice became my political home more than a decade ago when I found this movement that allowed me to bring all parts of myself together. I didn't have to separate the fact that I'm a Black woman from the fact that I'm born and raised in the South. I was just able to bring all of my identities into the conversation because all of my identities were critical to what was important for my life and what I needed for my life and the decisions that I had to make for my life. And so reproductive justice is racial justice. It's a movement that was created by Black women to ensure that reproductive health and rights was very much in connection to the very real social justice issues that impact our lives on a daily basis as Black folks, Indigenous folks, and folks of color in this country. And so we can't separate the fact that racial justice is absolutely a part of the work that we do every single day in this movement. And it's why the framework was even created by these Black women in 1994 to do this work with more intentionality and more intersectionality. And so we are in a racial reckoning in this country right now that's long overdue. And that fight absolutely connects to the work of reproductive justice as well. And so we have seen the fight against abortion access in this country, and we know that a fight for abortion access in this country is a fight against white supremacy. And so this work is, again, directly connected to what we do every single day. And I am excited to be working with so many folks around this country who are putting this work on the forefront and making sure that everyone that's connected to this work sees themselves reflected in it.
Great, thanks so much, Monica. Sid, let's hear from you.
Of course, thank you, Juliet. And hello, everyone. I want to thank everyone, firstly, Families USA for inviting myself and the National Low Income Housing Coalition to sit on this panel today. As you heard, my name is Sid Betancourt. I use she, her pronouns, and I'm a housing advocacy organizer with the coalition. And as an organizer, I connect directly with renters, grassroots advocates, social service agency providers, nonprofit organizers as well on a regular basis. However, most of my work happens to be centered around renter engagement, and I often hear stories about low-income renters, which disproportionately are Black, Indigenous, and people of color, and how in their communities they face systemic racism every day, not just in housing, which is what I mostly work in, but it also intersects very perfectly but also very sadly with healthcare. And you can see this in things like human, home, and community-based services. But at the coalition, we also ensure that we are elevating the voices of renters and tenants across the country and getting them involved. We get feedback from folks on national policies, and we also include them in our webinars just to get their feedback on our national approach. But we also do a biannual newsletter, which I work very closely on, and it connects renters to housing policy issues that affect their lives every day. And my predecessor actually did a really good job of this biannual newsletter called Tenant Talk on the fight for racial and housing justice. Just as Monica just said, that reproductive justice is racial justice, housing justice is also racial justice. And Families USA will share the Tenant Talk with you all who are attending. But if you want to read more about the work that we've done there, you can read through that as well. But I just want advocates to also learn that racial justice movements are effective at not only elevating these voices, but they also center voices that have lived expertise. And it's important that health advocates and health advocacy organizations always center feedback from Black, Brown, and Indigenous communities when advocating for policy change. In the housing world in particular, we have renter and tenant-based organizations such as tenant associations who are good examples to pull from, and they're often led by BIPOC leaders who work tirelessly to strengthen tenant and renter-based protections through local advocacy. And thank you again for having me today.
Great, thanks so much, Sid. I'm going to turn to Ola. Ola, we'd love to hear from you.
Thank you so much for having me. My name is Ola Ojewumi, and I'm a disability rights activist. I'm the founder and director of a small education nonprofit called Project Ascend, and we provide college scholarships to disabled youth and grants for community service and public service organizations. The reason racial justice plays such a major role in my work is because people with disabilities are disproportionately Black and people of color. We experience a duality of ableism and racism in this world, and we are often unseen, unheard, and uncared for. Racial justice has everything to do with disability rights. For example, 50% of those killed by the police have a disability, most of which are mental health issues. Racial justice comes in because these people tend to be people of color. Unless we put a face to the name of the movement that are people of color instead of the face specifically being white people with disabilities asking for accessibility, we will continue to fall behind. That's why it's important that racial justice and disability justice intersect, because our liberation is tied to equality, to accessibility, and to equal rights for people with disabilities.
Great, thanks, Ola. You know, and Ola, you're talking, and I think today's conversation, and for the audience who's joining in, you can appreciate that we are all bringing our lived experiences and a lot of intersectionality to the conversation. Ola, you highlighted the intersectionality of disability and racial justice movements, so that our audience can hear more about this. Could you give us a little bit more historical context? You know, as we've talked about and experienced the COVID pandemic, I think peripherally, we do talk about issues that are centered to the disability community. But again, given your leadership, we'd love to hear a little bit more from you in terms of the intersectionality of disability and racial justice.
I will say, you may not be able to tell by just looking through the video, but I am a disabled woman. I use a wheelchair, and I'm the survivor of a heart and kidney transplant. And when I learned about the disability rights movement, it was literally a section in a one paragraph section in my US government history class. And I felt compelled to learn more about disability rights. And in doing so, I learned that the civil rights movement and equal rights, the civil rights movement directly influenced the disability rights movement. Specifically, we can point to the Black Panthers, who assisted disability rights advocates in the historic 504 sit-ins. The Black Panthers provided food, resources, assistance to disabled advocates that occupied a federal building in order to demand accessibility and access. So without Black leaders setting the stage and setting the standard, we wouldn't have had a disability rights movement. We wouldn't have the ADA. And behind the scenes, there were Black disabled activists working grassroots who do not get recognition for their work. And racial justice ties in with disability rights in the way legislation and policy is made. People with disabilities are the living poor in the United States, and it comes with racism from welfare queen stereotypes. People with disabilities people don't feel like people with disabilities deserve equal access to healthcare, and you can see it in the COVID-19 pandemic, in which people with disabilities are seen as expendable and disposable. And that has everything to do with racism, eugenics, and who is deemed worthy of survival and who is not.
I really appreciate that. And also, I think a lot of what you started to highlight just in those couple of minutes actually really speaks to a lot of community context. And so thank you again for uplifting how Black leaders have had such an influence in our civil rights and justice movements. Sid, I'm going to turn to you. I know you're working at the national level. I think like many of us in this conversation and in the audience, we come from walks of lives where our work is a passion, where we're compelled to do this work at the local level and or perhaps the national level. So in the work that you do, could you highlight for us, how have the past 2 years of racial justice reckoning shaped your work and your role?
Of course. So I was one of the young professionals who actually started their career in the middle of the pandemic and the racial justice reckoning. And it really shaped the way that I did my work and the way that I approached my work. And, you know, like waking up every day and seeing this constant like racial injustice, police violence, you know, kind of tied together with the after effects of the pandemic and, you know, natural disasters induced by climate change. There was just like so many things piling on, and it kind of seemed like the world had kind of turned its back against, you know, Black, Indigenous, and Brown communities like across the world, not just in the country. But I think it's really important to acknowledge that up front, because I can't like really sit here and lie to you all and say that the work has gotten easier. But I think that, you know, it's that same injustice that continues to kind of fuel my passion for this work and integrating racial justice into it. And, you know, before in school, like I would be part of like volunteering and being part of like social justice type groups. But I think once I entered the work field, that's when I started really critically challenging my thoughts and ensuring that I'm learning the most that I can, not just through academic literature, which there is obviously a lot at the national level, but also the stories that you hear locally. And as an organizer, that's a lot of what I do, is just connecting with local groups and reading the literature that they put together. And particularly in the housing market, I've learned a lot about how the beginnings of it were rooted in blatant racism and policies like redlining, and what we see a lot now is gentrification, and some policy solutions that we've seen that have been kind of helpful and also not so helpful. And we know there's been studies shown that depending on your zip code, like that'll be like a determinant of your health outcomes like later on in life. The coalition itself has a campaign called Opportunity Starts at Home, and I do have some fact sheets that I'd like to share with folks. If we have those available, you can read through those as well, just so you can learn more about how racial justice and healthcare are very intricately tied to housing as well. But also, I try to stay connected with individuals who might be experiencing housing instability, because like I said, literature can also say so much. And I analyze a lot of like the small actions that I do like internally at work too, like how can I further racial justice at work? And sometimes that can mean like having difficult conversations with your colleagues and your superiors, but I think that that type of self-advocacy is also important at the national level, because they can be kind of pulled away from what's happening on the ground. So yeah, thank you.
Wow, thanks so much, Sid. You're giving us a lot to think about. And I will admit, I wish we had so much more time for this really terrific conversation. Monica, I'm going to turn to you. When you introduced yourself, we know you've got your years of wisdom and experience. And I really loved how you articulated you brought all of you to your work and where you are at Sister Song. So from your vantage point, either from Sister Song's perspective or your view of where the country is now, what kind of progress do you think has been made? And I think it's important to highlight that so those who are joining us today can hold on to that and try to sustain that kind of progress and really try to be a force multiplier. But I think we also want to hear what challenges still remain, because this needs to be top of mind as we individually and collectively move together as a community.
For sure. This conversation is so rich. I'm just really honored to be a part of it. And what I will add right now, when thinking about the progress that has been made, right? The fact that we are actually able to say the words white supremacy, the way that we're actually able to talk about how racism has been connected historically to every facet of our lives, that is progress, right? I feel like that was just something for some reason for so long, people did not want to talk about, but this racial reckoning has given us the door of opportunity to make sure that that is the center part of our conversation, right? That is progress in my mind. When I think about how it directly connects to my work of reproductive justice, like this work around sexual and reproductive health right now in this country is absolutely like at the forefront, and it should be at the forefront of everyone's minds. We are now looking at another Supreme Court case going before the Supreme Court, where we are chipping away constantly at Roe v. Wade. We are literally contemplating as to whether or not we will see Roe v. Wade make it to 50 years. That is a scary place to be in, because the communities that will be impacted the most by a law like Roe not being the law of the land anymore will be communities of color, will be folks who are struggling economically in this country. And that should be our focus. And so now that I see in our work, there are more Black folks and folks of color who are moving to the forefront of these issues, that we're actually talking about abortion. We're actually talking about what's happening to our bodies in connection to the other movements that we're doing this work for. People are seeing the connections between what happened to, between police brutality and like what's happening in bodily autonomy that's connected to sexual and reproductive health. Like people are seeing all of this connected. That is progress. We're not organizing and moving from like this single issue lens anymore, because people are understanding that we do not live single issue lives. Audre Lorde told us that, and we're now seeing what that looks like in practice. So I feel like there's progress in those ways for sure. And I think that we do have some ways to go. We need to have more people of color stepping into leadership positions, more people of color stepping into positions of power in this country, because if we want to really dismantle the systems of white supremacy, patriarchy, sexism, all of the things that are like connected to the root of the issues that we're all fighting for, then that means that we have to have a complete culture shift, right? Across the board. And we're starting to see some of that happen within some of the larger mainstream organizations in this country. We're seeing more people of color moving into political office. Like we're seeing the shifts, and we need more of that if we want to make sure that our communities that have been historically the most marginalized and the most impacted by these systems of oppression actually start to see themselves liberated and to see and feel themselves as free individuals in this country. That's the kind of progress that we need to continue to make. And that's what makes reproductive justice so powerful for me, because that's exactly what these Black women did in 1994. They're like, wait a minute, we're not seeing ourselves reflected in this movement of sexual and reproductive health and rights right now. We're not seeing our community's needs being connected to this work. We can't only talk about abortion. We have to talk about birth justice. We have to talk about what's happening with our families and what housing is available for us, what food is available for us, what healthcare is available for us across the board. Like all of those conversations were important to our reproductive lives in general. And so that model that these Black women gave us is what we're still standing on today. And I think that model and that framework has helped to move us and progress us forward in this fight that we're in right now.
Wow, great, Monica. I almost feel badly. I need to follow up with a question. I want to have your words hang here for a moment for all of us. Again, I am just really inspired by all of you. And in this work that we do, and making sure that our communities, our leaders, our families are visibly seen, acknowledged, and recognized. I do appreciate what all of you have highlighted. If I can interject here, I hear the practice of allyship. I hear the practice of the ability to hold space for these really critical conversations that are not easy. Just to be open to have space for these kinds of discussions, I think is critically important. And to be able to name it, whatever the it may be in this conversation of racial justice, health equity, and visibility really for all. I know with the pandemic, and the racial reckoning that our country has been experiencing over the last couple of years. Again, really also want to bring voice and visibility to our Indigenous communities. I know on a personal level, I live and work right here in Washington, D.C., and with the wave of anti-Asian violence, I never imagined that in my own neighborhood, and I literally live 5 minutes from Capitol Hill, knowing that I can connect with others like you, not just within community, but across all of our communities, I think is so incredibly important. We know the devastation each and every day this pandemic has brought upon our country, if not around the globe, and really the disparate and devastating impact upon communities of color. I want to shift just a little bit, especially as we're winding down our conversation in the next few minutes. Let's think about a paradigm of, given our experiences, what we've witnessed. I want to think about this notion of a just pandemic recovery. So let me ask you, if we can just popcorn kind of quickly here, how can we harness and grow this power of our communities to ensure that the diversity of all of our voices, not just some, but all of our voices, including an intergenerational perspective, because I think a lot of you touched upon that too, which I think is a core value to so many communities of color. But again, how can we harness our power so that our voices can really influence and help create a just pandemic recovery? I'm going to popcorn here again. Let me start with Ola, and then I'll go to Sydney, and then back to Monica. Ola?
I think we really need to start organizing on the social media level and meeting people where they are. I'll give you an example of how the disabled community engaged with the CDC regarding some statements the CDC director made that were quite problematic and quite ableist. In an interview, the CDC director stated that she was encouraged by saying that the number of people dying had 4 or more comorbidities. Comorbidities basically just means disabilities. And for anyone to be encouraged that people with COVID-19 who have died are people with disabilities, that says something about our values as a society and how we view people with disabilities as unvaluable. So as a result of people with disabilities, activists with disabilities online, even the hashtag my disabled life is worthy, they actually met with the CDC director and talked about how ableist the CDC policies are, how ableist her statement was. And even an example is the 5-day isolation period. That is not enough to ensure that this virus will not spread. So the way we organize in meeting people where they are, specifically organizing with disabled people who are the most affected by this pandemic, who are predisposed and more likely to be infected and more likely to die, it starts with meeting people where they are. And I believe that starts with social media organizing.
Wow, thanks so much, Ola. You know, and as you're sharing that also, and I see we received a couple of questions, so I'm going to kind of integrate this as we move on to hear responses from Sid and Monica as well. Ola, I think what you helped to do is you actually highlighted practically in this justice movement how advocates and voices can come together to bring about a deeper conversation. So I applaud what you and the disability leaders have done to hold that conversation with the CDC director. Sid, let's hear from you.
Of course. I think as someone who kind of works as a community liaison at a national organization, I have seen like time and time again how important it is to invest, and I mean like fully invest like all your funds into smaller organizations who have like the passion and the drive to help the communities because they're so connected to them, but just don't have the money or the people to do so. And I think that's really important. And one of the lessons that we at the coalition learned through the emergency rental assistance program and the eviction moratorium, because we saw that research shows that the moratorium did save lives, and that folks being housed, you know, were less at risk for COVID than being outside of their homes. But after the moratorium ended at the end of the summer in 2021, we saw that evictions were starting up again. And even though the emergency rental assistance dollars were getting out, they were slowly getting out, and they were running out of the funds in some of the states. So we have a project at the coalition called Erase. And so we've been able to kind of see the collective power that these organizations have across the country to get these funds out, many of which were able to get an assessment out and get feedback from BIPOC communities so that administrators could implement these changes into their emergency rental assistance programs. And we were very purposeful in the way that we selected these grantees for the project, because we wanted to make sure that these grantees were mostly like BIPOC-led organizations, but also very connected to those communities that needed the funds most in need. And, you know, in growing our powers, we also have to validate the experience that we're experiencing together collectively as a society, as I said earlier. Yeah.
Great. No, thanks so much, Sid. Monica, I'm going to ask you to round us out on this question, and then I'm going to share just one last question with all of you. So Monica, let's hear from you.
Yeah, for sure. I would just add two things. One, those folks who are like those who should be leading the solutions right now in this very moment should be those folks who are most impacted by the oppressions, right? That are real in our communities. And so that means that we have to have a level of trust, you know, in our grassroots communities, in the leadership of BIPOC folks, that's Black, Indigenous, people of color, to really lead us into this new way, right, of how we do the work, right? I think that what this pandemic has shown us is that the way that we have been doing business, the way that we have been moving work, the way we've been moving resources ain't necessarily working, right? It's not getting to the people. It's not creating the solutions that we need. And so this is a time for there to be deep trust, right, in the leadership of people of color. It is time for deep investment, right, in terms of resources in communities of color, in organizations and folks who are working directly with those communities on the ground. And we need to break those barriers, right? We need to break those barriers. We did that very specifically in one way that we've been able to re-grant over $1 million back into our social justice ecosystem, because we were trusted to be able to move money to the grassroots, right? It was through our RJ for Black Lives re-granting program, where we were able to put money back into organizations working at the intersection of the movement for Black Lives, policy platform, and reproductive justice issues. Powerful work. It takes like those bold moves from philanthropy, from media, from healthcare, from all the different systems that have been locked into doing work in a particular kind of way to say that we have an opportunity to actually do this thing differently, and that is what is required right now in order for us to see a just rebuilding, right, as we move to this world on the other side, hopefully, of this pandemic that we're living in now.
Okay, well, wonderful. I'm getting the cue that we are out of time here. Let's see. I don't know if we have a chat box. I'm actually going to take moderator privilege. And as we close out, what is one word you can share with us in terms of what you do for self-care? In this movement of racial justice and with the Health Action Conference, it's so important that we ensure that we don't burn ourselves out. So let me ask our panelists, one word, what do you do for self-care? Let me start with Monica, Sid, and Ola. Monica?
I gotta say 2 words, it's rest and create, right? Rest and create.
Great, thank you. Sid?
I'm gonna say Zumba.
Zumba, love it, love it. Ola?
I'm gonna say rest as well.
Wonderful. I'm going to add to this, and I'll add meditate. Well, I want to thank all of you for the audience. I hope you'll join me in applauding and celebrating this terrific panel of amazing and inspiring leaders. Thank you all. Be well and take care.
Thank you so much.
First of all, I just want to also extend a heartfelt thank you again to our panelists and our moderator for offering their time and expertise this afternoon. Conversations about these connections between health and racial justice are so critical to our work. And it's our hope that you can apply some of these best practices to some of the work you're doing in your respective communities. If you'd like to learn more about the racial and health justice work our speakers mentioned and what they're doing, you can learn more about them by viewing their profiles on the conference platform. Again, many thanks to our wonderful panelists and our moderator for leading this discussion today. So I know some of us are visual learners, so we have a visual note taker working to capture our conversation. Let's take a look at what they've recorded so far. That's a really great depiction of the discussion. So please look out for the final version at the end of the day. And in the spirit of self-care, we're going to be taking a 10 or 15-minute break now, so you can stretch, grab a snack or a beverage, and join us when you're ready. I also want to encourage you to check out our engagement hub. There you're going to find our wellness corner for yoga, meditation, the little advocate story time, and some soothing pet videos. And also be sure to check out the partner booths to engage and take action on the health issues you care about. If you'd like to connect with other attendees during the break, please be sure to use the directory at the top where you can send individual messages and chats to other attendees and even have one-on-one virtual meetings. So we'll resume at 2:45 Eastern with our first workshop session, where you'll be able to choose an advocacy, policy, or communication track. We'll be covering vaccine equity, the Medicaid program, and utilizing digital communication strategies for health justice. You're not going to want to miss these. Lastly, don't forget to keep an eye on the notification icon at the top of your screen to help you navigate the conference. Remember, if you experience any technical difficulties, please use our help desk icon at the lower left of the screen to connect, or lower right, excuse me, to connect with the live agent for assistance, or email tech-help@jdc-events.com. So thank you again for joining us today. We're so excited to have you all here and hope you're enjoying the first day of our Health Action Conference. See you back here soon. Thanks.